scientists that say clearly, or that says clearly, that the dynamics of the virus have changed. Indeed, we do understand that they are doing some further rounds of analysis on how the virus has been operating within our Ghanaian ecosystem. But it is worrying that, yes, a lot of young persons are falling even within the general positivity category. And as at now that we have the 95 deaths, a good number of them also being young persons. I think the simplest caution we can put out there is that ensure that you don't become part of the positive statistic in the first place. And the way to do that is to take this seriously. There still are people who believe that this is a hoax and this is not true, but we need to take it seriously and ensure that we protect ourselves, because you do not know if you would be that young person without underlying health conditions who, when he or she turns positive, will end up passing on. You can't tell. Even as they conduct their studies, it's best to ensure that you don't fall within that category in the first place. And I think that's one of the areas that we need to spend some time doing public education on.
So as the death rates increases, the numbers keep going up.
So about 95 now.
95 now.
Yeah.
The concern is, apart from those with comorbidities, what kind of treatments are we giving to them, and is that being studied or monitored over time to ensure that the successes or otherwise is learned from, and then we can move on past it? So
my understanding from what the clinicians tell us is that this is not a virus that you can cure, that you can get on medication to cure. The supportive treatment that they give, or the treatment they give, is called supportive treatment. Essentially what they do is that they aid your immune system to gain strength and to fight it on its own, to develop the kind of antibodies that can fight it on its own. And so medication, etc., generally is medication that is boosting your immune system. That is why even get into a care management stage, we're saying that also in terms of your diet and the things you do things that will ensure that you have a strong immune system, so that even on your own, assuming you're exposed to the virus, your system could fight it very quickly. If that doesn't happen and you fall into a positive category, the kind of medication they give primarily is aimed at boosting your immune system. But for those who end up having some severe complications, they have various kinds of medication that they give to aid you get out of those severe state. And quite recently, I think in the UK and in other places, they've been talking about a particular drug which they are now finding that when people get into severe conditions can help reverse the severity of that. So the medication essentially for immune boosting does not change. Diet for immune boosting does not change. Depending on your underlying health condition, if you have a severe condition, they may have to give you something to get out of that one. But we can't stress enough that the safest option out there is not to get into the bracket in the first place.
We are in flu season, or the season where we are more likely to catch a common cold. With the symptoms being as they are, very similar to COVID-19, are our health facilities equipped enough to differentiate between COVID and flu? Because we are hearing that potentially persons who present at facilities with common cold may either be turned away or be isolated unnecessarily because of the fears of a positive test.
And this is what goes back to the initial training that our health persons or health personnel were given on how to identify symptoms and how to see how COVID possibilities present. Admittedly, a good chunk of it would look like a common cold until there's a proper PCR test to tell what kind of virus is causing these symptoms. Until then, what our health professionals are required to do is to ensure that at a pre-triage stage, and even as they do the triage processes, they themselves are protected. Persons with suspected viral conditions are separated and tested very quickly. Test results are known very quickly, so that if indeed they are COVID-related matters, they can then be moved into treatment facilities. If the case management protocol says that these persons have to be moved there, they can be moved there for treatment. But the only way to tell is by doing a PCR test at this point in time, because you know that we've not been successful in the IDTs currently. but it's to do a PCR test. And until then, it means that health persons will have to ensure that they are protected, they do the pre-triage properly, they can separate you if they suspect, and ensure that if indeed the test results do come in quickly, they're able to give you the necessary treatment. Yes, the test results are beginning to delay a little bit because I think there's been a little gap in the availability of all the logistics required, reagents, etc. But they are working quickly to show up those numbers so that what appears to have been a little slowdown in the results announcement process from the labs between the taking of samples and the processing is closed up, and it can help quicken the rate at which we are going.
So we have increasing positivity rates, we have increasing death rates. In the midst of all that, the government that is leading the fight has primaries with those asking us to practice ABC, seen on video, appearing not to adhere to. So it's like asking me to do something that you say but not what you do. How do you react? Even the president has called it unfortunate that certain protocols were breached at several locations during the MPP primaries.
Yeah, so I'll break it into various parts. First of all, in the parts of the exercise that are within the control of the party, i.e. the voting process, you would notice that all the safety protocols were adhered to. You would find Veronica Bucket, you would find sanitizers.
But there were some centers that our reporters were present at that did not even have Veronica Bucket. And we have a video, we would see it very short, of people jubilating.
So I'll break it into various stages. First of all, if there was a center that lacked a particular item, if you take that as a percentage of the about 4,000 centers, that would be a rare exception. But for example, the reports that we have, the brief that we have suggests that as much as possible in all of these voting centers, you will find the Veronica Bucket, you find the hand sanitizers, you find the enforcement of the rules of wearing masks before you're allowed to participate in the voting process and the collation process. Now, you find another part of the exercise that is not exactly within the control of the party. So, for example, when results are announced and supporters want to celebrate, it is difficult to have the party machinery exactly control how supporters celebrate. Or when there is the appearance of difficulty at a particular polling station, and it appears that people have their passions up and get into some argument or something, it is immediately a bit difficult to gain control of that situation. And I think that's what the president describes as unfortunate, that those incidents are unfortunate and very unhealthy, especially at a time when all of us are making the point that, listen, we need to respect these preventive etiquette. It doesn't matter how happy you are or how angry you are, you need to ensure that these preventive etiquette are followed. But beyond that, I think it also serves as a lesson to us as activities resume across the country. Some of the infractions are occurring. It gives an opportunity for us to introspect some more and make a determination of what needs to be curbed in a particular way. And so what has happened over the last weekend, as much as from what I observed, the party did its best to control it. And then beyond that, when individual supporters, etc., are getting excited, it's difficult to control. Also serves as a lesson on how moving on, especially in this election year, some guidelines may perhaps be brought to bear on how collation and how activities around polling stations should be by the time voting is done and even counting is done.
If we're using this as a test of our readiness as we enter election campaigning period proper, look at what is on the screen now. All the persons there do not have masks on. Absolutely. They are not observing social distancing.
Absolutely.
And they appear to be talking, which we have been advised not to do if we are not wearing the mask.
Absolutely.
Look at those videos. Do you understand why a certain group of people are peeved?
Absolutely.
Those who are leading us are not obeying.
Absolutely. The first video that you showed, I'm not quite sure if it's the election day video. It appears to be one of the campaign videos. Admittedly, if that campaign was between March...
This was from Saturday.
This was from Saturday, yes. I see. I was even going to say that if it was between March and now, it would still make no difference, because between March and now, we're still preaching the same principles. But the point I'm making is it serves as a good guide for us moving into the election season on what perhaps they may need to come up with guidelines to say we cannot do. Maybe what it means is that on election day we can only vote and have to go back home and not be around the precincts for such exciting moods to now lead people to go out there. So I think, simply put, you can tell that the parts that were clearly within the control of the party in terms of the voting process, quite well observed. The part that appears to be individual supporters, either angry or excited, obviously you will see instances of that getting a bit out of hand, and it gives us opportunity to make the necessary guidelines moving forward.
Now, the other thing that has also made the past weekend also quite informative for us has been the recoveries. We went from about 4,500 to 10,000 plus recoveries within a space of a few hours.
Yes.
And that was because we were told at the brief on Thursday that the discharge policy had been revised.
Yes.
So the question on the minds of many, why would you discharge people who are not recovered? And the scientists have given us an explanation.
Well, so it is not a discharge of persons who have not recovered. I think even this morning at our briefing, we gave an opportunity for the scientists to further explain. The persons they are discharging are persons that they say have recovered. Now, when you say recovery, there have been two arguments about recovery. The first has been what they call clinical recovery, which is that when they observe you, you no longer bear signs and symptoms of the disease, and most importantly, you are not infectious. You are not able to spread it to any other person. And that is what they call the clinical recovery. At first, when the virus was still very novel, they used what they call the laboratory recovery, where before they declare you recovered, they need to conduct 2 consecutive negative tests on you. Further learning from Singapore, from China, from Germany, even from Ghana, demonstrates that a person can still test positive in the lab, but will not have active viruses within their ecosystem or within their body, because sometimes even when you have overcome the virus, when they apply the reagents, the remnants of the virus in your system will still show as positive. Indeed, that is why in Japan, in the early stages, they would say that there are incidents of persons testing negative only to test positive when their fecal matter is tested later, because while they have generally gotten rid of the virus in their system and you won't find it in their respiratory tract, when you test fecal matter, you will still find remnants of the virus that will test positive in the lab. I think quite recently from China as well, they said, okay, so after a while you can't even find it in the fecal matter, but you can find it in the semen. I'm sure you recall that study. Yes. They have now done further studies to show that some of those positives, after the first about 10 days, even though the remnants of the virus will still test positive, you can't even culture the virus, i.e. you can't see it grow, you can't see it multiply, you can't see it infect someone else. So it will take a longer while for the PCR tests to now show totally negative. Now, if in that instance you are still keeping these persons in isolation facilities and on hospital beds because you are waiting to do double negative tests, then you are going to keep a lot of people who have clinically recovered on hospital beds because you are saying that they have not recovered according to the lab. So de-isolation is a way of decongesting the centers? Not necessarily. I think the verb that they used was de-isolate the following persons. The following persons being persons who are asymptomatic after 10 days, who may still even be testing positive, because after 10, indeed the data is after 8 days, but then they give a caution of plus 2 days. So after 10 days, you can de-isolate those persons, you can take them off the treatment protocols because they have clinically recovered. In Ghana, from the 27th of May, when the WHO revised this treatment guideline, you know, the first treatment guideline came in January from the learnings in China when China published their treatment guidelines. And then they have done a number of updates, the latest being on the 27th of May 2020. In Ghana, when that update came, Ghana did not apply it. Ghana now sought to do its own studies and has now proceeded to test several persons who were testing positive after treatment, have proceeded to go to the lab with the remnants of the virus in an attempt to culture it. And the Ghana case also shows that you can't culture the virus even after about 8 or 10 days. So Ghana's revised position is that don't even take the 8 days, don't even take the 10 days, make it 14 days, just to be, if there's an expression like double sure, just to be double sure. And then after 14 days of an asymptomatic status, you can then take this person off the treatment and the preventive protocols, because they are not in a position to further infect anybody else, and they themselves are no longer a risk to themselves. But of course, this will also be mitigated by the risk profile of that person. So if that person, for example, has some comorbidities, etc., the clinicians or the case management team will factor that in making a determination whether or not they really want to discharge this person.
And where do these discharged numbers fit into our grand scheme of apportioning numbers? So we have 400 plus new cases daily. We have this number of active cases.
Yes.
But we've bunched together recovered and discharged together.
Because so recovered and discharged, the view of the clinicians is that those persons recovered. Those persons who have either in the beginning done the 2 negative tests, or who currently, because of the new guidelines after 14 days of being asymptomatic and therefore are classified as being clinically recovered, they put them together and then they say that at least you have clinical recovery for all of these persons. That's why you have 10,907 persons who are at least clinically recovered. You still have 3,566 active cases, and for me what is even more worrying, about 400 new cases and in a day. And that is what we need to focus a lot of attention on, to ensure that we're able to bring that daily new infection or the new cases down, which is why His Excellency the President has now moved towards EI 164 to make it mandatory. Because if it's not mandatory and you have persons who are able to infect others, not wearing these masks and going around business as usual and infecting other persons, then you're going to have new cases going up, as is the case.
And the President spoke to us on Sunday, and that was one of the things that he mentioned, that enforcement will begin and the punishment will be severe.
Yeah.
A 10-year sentence for not wearing a mask.
You think it's too severe?
Steep?
Well, we have had 95 deaths. People must begin to take this a lot more seriously than we are taking it now. One of the philosophies of punishment for those of us who practice the law is that punishment or sanctions is supposed to be, as a first step, deterring of persons who may contemplate that action. One of the reasons for which the potential punishment for murder is capital punishment is just so that it is also so deterring to other persons who may contemplate it. And if you don't make these sanctions deterring enough, you will find people taking it business as usual. So one of the first things is to ensure that the sanctions are quite deterring and therefore cause people to think twice. This I think earlier this week, one of the interesting conversations has been, what about a private person in his private vehicle by himself or herself?
Yeah.
Now, while we acknowledge that technically there's a conversation to have there, it is because of the severity of the sanction. That is why people are rising up to this reality that, oh my word, I could go to jail just for being in my car by myself and not wearing a mask. So it goes into to the earlier principle that if the sanctions are not severe enough, people don't take some of these things as seriously as they should. But I think also what we have done is that earlier today, we've openly mentioned that the law must be applied with a purposive approach. The law enforcement authorities are being asked to look at the intention of the lawmaker. The intention of the lawmaker is to compel all persons in public places to wear a face covering. And so if you look at the literal interpretation or the literalist interpretation, you may go into what some may call some excesses and some high-handedness. But if you look at it from the purposive approach, what is the purpose? What is the objective? What is the intention of the lawmaker? then you would be able to exercise your discretion in a good way in some instances and say you've got to put it on, or once you're coming out of your vehicle, you have to wear it on.
The bottom line, should you wear a mask if driving alone in a car? Bottom line, will you be arrested if you drive by yourself without a mask alone by yourself now?
The law is that if you are going into a public place, you should wear a face covering. The law further states under 1B that if you are going into or out of your house, you should wear that face covering. As we've mentioned today, it is our understanding that the law enforcement authorities seek to interpret the 1B to mean that if you are in your car by yourself, you should still wear it. And that is why we have drawn their attention to what the purpose is. The purpose is not to criminalize you being in your car by yourself and not wearing a mask. The purpose is what has been stated in the object, to ensure that when you are going in a public place, you wear a face covering. And that is why we are, or we have actually engaged the Ghana Police Service earlier today, and I think even yesterday, to ensure that their officers on the beat who are enforcing have clarity on the purpose and apply it with that purposive
clarity being basically
intention.
If the person is by themselves driving a car not wearing the mask, they cannot be arrested. The
police will stop and caution you and advise you so that you ensure that, especially as you will be getting out of, because that vehicle will not necessarily go and come without you maybe getting out of the vehicle. And so they will stop you, they will have a conversation with you and give you the necessary guidance. But the purpose, what we seek to deal with, is people in public places, not necessarily in the comfort of their private vehicle, who are not wearing that face covering. And that is why we've done that engagement with the Ghana Police Service, to explain it clearly to their officers so that they apply it accordingly.
Thank you. You're watching hashtag Ask the Info Ministry live on GTV, GBC News and on Garden City TV in Kumasi. The Honorable Minister for Information, Mr. Kojo Nkrumah, answering your questions, and we'll take some more from social media. And as we prepare to do that, we've been talking about the enforcement of the EI 164 and as to whether we should wear masks when driving by ourselves or not. Now, Honorable Minister, there are some communities that started a low-key enforcement or sanctioning of persons, like having them sweep the streets and picking up litter or engaging in some sanitary activities. Why have we considered non-custodial sentence, especially because our prisons are already bursting at the seams?
If I understand what some of these local authorities were doing prior to the Executive Instrument 164 coming out, I get the impression that they were trying to make the action of not wearing the mask in the public place unattractive, but we're also not seeking to commit people into custody. And that's why on their own they resorted to some of these, may I say, non-custodial punishments at their own discretion. The law in Ghana does not necessarily give that framework where a police officer or a security officer will have the discretion to decide that you sweep 1 kilometer or you weed 3 patches or otherwise. And so now that the executive instrument is in place, we expect these security officers who are there, who are complying, to comply with the executive instrument, or if they have to use their discretion and it is a matter of guidance and caution, like what was being practiced in Accra earlier, then they apply that guidance and caution.
Right. Now the senior high schools have partially reopened for final year students and go track year 2 to finish their coursework, and then for the final years to write their exams. And we've been told that no visits will be allowed. The president assured parents that the students will be safe. Have we learned from the reopening of institutions last week, especially as a case has been confirmed at Accra Technical University?
So even before we started reopening, we've been looking at what's been happening in other parts of the world. There have been places, I think France, etc., where after schools reopened, you will find some cases popping up here and there. And that is why in building a framework, partially reopened some of our institutions, contingencies were made. First, to protect students, but also how to ensure that persons on campuses are regularly screened and should there be a case, what needs to be done. I think in one of the cases that is being reported today on the news wires, which I'm sure will come through the Ghana Health Service collation system, so that they can also give us the details as they have found it. If I'm correct, the kind of contact tracing mechanisms we have put in place, the kind of screening mechanisms we have put in place, have been successful picking up an incident like this, and hopefully will be successful in containing it, so that the majority of people can go about their tuition and their examination processes without being affected by what hopefully will become this isolated incident. So have we learned? Yes, we have learned globally. We've learned from what happened in Europe, in other parts of the world. We have tried to adapt it and put in place mechanisms so that you can quickly identify, if you have an instance like this, isolate and contain it. Then the majority can have their tuition and examination, and you can deal with this particular instance as well.
Right, let's take a few questions on WhatsApp, and here is one from Frank Bruno in Dansoman. He's saying, those study leave nurses that were recalled, have they been recalled back to school to write their final exam? Are they going to extend the student preparation period for the exam? Are all students going back to school being tested for COVID-19? Are they evaluating the adherence to the laid down protocols in the schools? So adherence to the laid down protocols, and student nurses, whether they'll be given more time. Here's another question. So far, I'm not impressed at all in the way the media handle interviews. They look on unconcerned as interviewees push away the mask when talking. I keep asking myself, when are they supposed to wear the mask? Is it when they are quiet and in solitary space? So when are we supposed to wear the mask is the question here. This one says, congratulations to the minister for the just ended NPP family election. My first question is, the COVID-19 team now have an outbreak alert response surveillance team. My second question is, have you invited senior medical doctors who are 60 and over and are now home to help find answers to COVID-19 invading into Ghana, since WHO could not contain the outbreak from China? This is from Alhaji Dauda in Medina. I don't know if you'd like.
Let me start with Alhaji Dauda. There's a very strong team of epidemiologists, public health experts, and specialists that work with the Ghana Health Service, and they also have contacts globally that are giving them perspectives and advice. It is this advice that they, the scientists and the experts, bring to the national task force, and therefore make policy decisions at the task force level, which policy decisions are then announced, etc. And yes, you can be rest assured that as much expertise as is available locally and internationally, they are bringing to bear on that exercise in, like you put it, providing answers to the COVID-19 management program. And that is why you find that in a lot of instances, for example, the WHO may say something, Ghana may choose to go a particular way. Remember, the WHO was talking about general surveillance. Ghana was one of the first countries to opt to go a step higher to do what we call the enhanced surveillance, and now you have many other countries beginning to follow our example. When it came to mandatory quarantine, for example, Ghana, one of the very first countries, based on the advice from all of these experts, and not just about their age, some of them may be young, etc., but they have a lot of expertise. So yes, a lot of expertise around the table, informing the science and the data, which is what the task force bases its decisions on, and then as a government we're able to execute that accordingly. When do we wear the mask? In fact, today I had a cause to draw the attention of one of my colleague journalists at the press briefing, who dutifully wore the mask, stepped out to the microphone and took off the mask to speak. And I was trying to explain to him that the risk is actually when you are speaking. That is when the droplets can come out. So you actually have to wear it and talk. And I hear people say, I'm not comfortable with it. The idea is that if you're not comfortable with it, then you wear it and come and do what is necessary outside or in public, and you quickly get back into a private space where you don't have to wear it. Like we've said, we're not in ordinary times, and so we can't have the freedom to do everything that we're doing like before. Then there's a question about testing of students and evaluation of adherence. So yes, we are evaluating the adherence. You recall the president gave an update on Sunday in which he gave an update on adherence at the tertiary level in the first 1 week. Indeed, prior to that, the Thursday before, we had mentioned that the early feedback was that there was adherence, but we were of the view that by the end of the week some more data will come in, and that's what the president has been talking about. And we'll continue to observe or evaluate the adherence in schools and in the general public. The president mentioned that the police and other organizations will be doing some snap checks. So yes, we're continuing to evaluate. The decision is not to test all students, teachers and non-teaching staff before they go back into school, because as we have said, a test is not a panacea. Rather, the screening exercise will help us find persons who are in at-risk populations, and then you can test those persons. If I'm correct, if my data is correct, a single test is about $50 or so. If you have over 9 million people in school, and you say you should test those 9 million people, mind you, a single test before they go to school even does not mean that they can't get it the day afterwards. So if you're going to test, then you might as well be testing, what is it? Is it every day or every other day? And is that feasible? Is that a preventive mechanism? No. And so the view has been to put in the screening and the preventive etiquette and to ensure that if you have an incident like what is being reported, which as I've mentioned is yet to be confirmed through the Ghana Health Service System, you're able to contain it quickly and deal with it.
Right. We'll take some of the questions that we've received earlier from you, and then we'll find answers. Let's quickly go through a few of what I have streaming here because they keep going up very fast. Samuel Nane says social distancing was breached and should be condemned and punished. I presume you are speaking about the NPP primaries. The minister has addressed that. Please ask the minister that the WASI registration fee going to be refunded in various schools. So is the WASI registration fee going to be refunded? Because some students paid it before schools were closed. So Honorable Minister, take note. Honorable, please educate your law enforcement agencies. My friend and his wife were stopped and cautioned by a police officer for not wearing face mask in their private car.
But this is the point. Let's hold it right there. So it is no longer a single individual in his private vehicle. You see, the object is to ensure that you don't infect others. That's why we're saying that when you're going into a non-private space, you wear the face covering so that you don't infect somebody. I'm not sure that we're able to say, oh, this is my wife, so I'm allowed to infect her because we are in our private vehicle. If you are in your vehicle by yourself, that is where we are saying that the purpose does not affect you. But if you are in a vehicle with other occupants,
then you have to wear it.
You have to wear it. It is like being on a public transport vehicle. You cannot differentiate that because this is a private car,
and that's
the virus will not spread in a private car. Once there are other persons in it, if there's somebody who is positive who can infect other persons, then the logic holds that that person can also infect other persons, whether it is a private car or it is a public vehicle. But I think the gray area, which we all concede, is if you as an individual by yourself in your private vehicle come into contact with the police, and that is where we are engaging with the police so that they bring clarity. But it's not about private cars. I think we have to be very clear. It's about other passengers in the vehicle.
Right.
So if it is you alone, that is where we're engaging with the police to apply the purpose, because the purpose is to ensure that one person does not infect another. It doesn't matter whether the infection is in a private car or a public vehicle.
Right. Let's quickly have a listen to the questions that we received from you on our WhatsApp platform, and then we'll find answers for you. So let's have those questions now.
I am Michael from Kumasi. I want to ask the minister whether they conducted any research about the long using of the nose mask, its health implications on people. Especially some have been wearing it for 8 hours, 12 hours at the workplace. Have they conducted any research about it, its health implication, so that it does not cause another health issue for Ghanaians in the long term? Thank you and God bless you.
Yefemi Gideon from Kumasi. Honorable, me say me who the entire always there's sudden increase in the cases. Is it a community spread or contact tracing, anaasɛ ɔmo report to the hospital na ɛma de bia yɛtumi record saa outrageous cases ɛwɔ Ghana ha no medase
nose mask na health minister ɛyɛ ba Mr. Seka provide via akyire na nkadeɛ no ayɛ force obi hɔ no ma de ɔde twa deɛ ne adi kora no ɛɛden so ɔmo ne companies ne bɛka sa na ɔmo tumi ahyɛ health minister no ase na ɔmo provide na ɔmo bɛboa na yɛtumi ayi so adeɛ no sɛ baabi a yɛadeɛ no ɛtrɛ kɔ no deɛ ɛɛden yɛsrɛ sɛ abaa no ne health minister nso bi sɛna ɛbɛyɛ bɛtumi ahyɛ wɔn a ɛni bie no ase no ɔmo nso atumi de ɔmo ho agye wɔn a yɛadeɛ no atumi abra ase.
Currently we have the third year students who have already resumed academic work. I want to find out what are the plans in place to bring in the continuing students, meaning the second, third, and then the fourth, the third, second, first year students. And then also the remaining senior high secondary students at home.
Good day, Honorable Minister. My name is Enoch Amwakon from North Legon. My question is, I just learned that the President, His Excellency Nana Addo Dankwa Akufo-Addo, will absolve the WAEC registration fee for all SHS3 students. I would like to find out where his source of revenue will be to foot the bill, considering the fact that he has already absolved some of the utility bills of the past month.
My name is Mohammed Abdusalam, University of Ghana, Legon. Honorable, I'd like to know if there are patterns in what I'm about to say. 1. Akufo-Addo was misled. New American deal is off. Gabi Ochredaku statement. Nana Addo was misled. NHIS paid only 1 month's arrears. Upper East healthcare providers say. Akufo-Addo was misled over commissioning of ambulances. Akufo-Addo was misled about coronavirus deaths before further easing restrictions. Occupy Ghana. Honorable, I'd like to know if Akufo-Addo is not misled this time by the recommissioning of schools, because our lives are at stake. Is there a pattern between these statements, or they are just mere coincidence?